Good afternoon, students. I want to talk to you today a little bit about data sets and health information management. First, I'm going to discuss why are data sets and health information management important to nursing students like you. Students use technology to gather and use data in assessing, planning, and evaluating individual patient care. Learning concepts of data management and healthcare are essential to providing safe and quality care. The most important data management tool that promotes student knowledge in data management is the electronic health record. The influx of computers and health information programs have provided the opportunity to rapidly collect and organize large data sets. These computer programs can help providers assess and problem solve for both individuals and large populations. So we're going to discuss first about data sets. So what is a data set? A data set is a collection of related sets of information composed of separate items, which can be manipulated as a unit by a computer. A single database table or a single statistical data matrix can be a data set. The set of items can consist of just a few items or millions of items. Either way, the fact that the items are placed together makes them a set. Now, what is a data set in healthcare? Healthcare data sets include a vast amount of medical data, various measurements, financial data, statistical data, demographics of specific populations, and insurance data, just to name a few. These are gathered from various healthcare data sources. And I put this graphic in the lower corner here to just show all the places and such that we can take data from. Now there are two legislative acts, the HIPAA 1996 and the HITECH Act 2009 that I'm going to discuss. So data interchange in the U.S. healthcare industry is strictly regulated, both on national and federal levels. The Health Insurance Portability and Accountability Act, as known as HIPAA, was published in 1996 and is the core set of healthcare IT data standards. The HIPAA rules regulate the use and disclosure of personal health information and establish national standards to protect individuals' electronic personal health information from data theft. The second component, the Health Information Technology for Economic and Clinical Health Act, or HITECH Act, was adopted in 2009. Its aim is to improve healthcare quality, safety, and efficiency through the promotion of health IT. This includes the electronic health records and private and secure electronic health information exchange. Next topic, HIM, or Health Information Management. So what is HIM? Health Information Management is information management applied to health and healthcare. It is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. With widespread computerization of health records, traditional paper-based records are being replaced with electronic health records. The tools of health informatics and health information technology are continually improving to bring greater efficiency to information management in the healthcare sector. Both hospital information systems and human resource for health information systems are common implementations of HIM. With the influx of technology into the healthcare system, health information management careers grew exponentially. Computer IT professionals work away from the patient bedside to best support clinical providers and thus patients. HIP professionals are integral to improving patient outcomes and helping bedside personnel provide safe and quality care. HIM professionals, they plan information systems, they help develop policy or health policy, and identify current and future information needs. Additionally, they apply the science of informatics to the collection, storage, analysis, use, and transmission of information to meet legal, professional, ethical, and administrative records. They also keep requirements of healthcare delivery. They work with clinical, epidemiological, demographic, financial, reference, and coded healthcare data. Health information administrators have been described to play a critical role in the delivery of healthcare in the United States, with their focus on collection, maintenance, and use of quality data to support the information-intensive and information-reliant healthcare system. The World Health Organization stated that the proper collection, management, and use of information within healthcare delivery systems will determine the system's effectiveness in detecting health problems, defining priorities, identifying innovative solutions, and allocating resources to improve health outcomes. So why exactly is HIM important? The storing of all of this knowledge as digital data makes it easy to organize and access, and thus more useful to healthcare professionals serving many patients simultaneously. It also allows patients to experience a continuity of care between the many professionals working on their case. It reduces the risk of handoff errors and provides a more robust patient profile for diagnostic purposes. Managing the wealth of available healthcare data also allows healthcare systems to create holistic views of patients, personalize treatments, improve communication, and enhance health outcomes. So we're next going to discuss the benefits. What are some of the benefits of HIMSS? First is the documentation for safe practice. It aids in preventing errors through clarity of information and enhanced communication among professionals. Second, quality improvement. It allows reflection on practice to improve care through data feedback. An example of this is our quality improvement committee in the hospital has audited charts for specific discharge criteria to make sure that our patients are meeting that criteria. Third is patient self-care. Patients have opportunities to gain access to their own records and are available whenever they seek care. This is an example of how we maintain continuity of care and safety in a clinical area. And an additional example of this is Rochester Regional Health has their MyCare portal for patients to connect to from home. Next is team communication. Team communication is promoted through the use of information systems for example, it's easier to contact the lab or pharmacy directly through the system or page providers. And Epic has all of these components, which is a common HIM system. Next is decision support. It provides opportunities to support nurses' clinical decision-making, i.e. Triggers for medication interactions or if sepsis markers have been met. And last, monitoring. Monitoring of patient data and patient trends over time. So it's easy for providers to see if patient is at their baseline or not by compiling that data. Some additional benefits of healthcare data management, maybe from the business or administrative level, it improves population health outcomes in specific geographic areas by tracking current health trends and predicting upcoming ones. You can make informed or high impact business decisions based on the data. And you can also understand physician activity and how they align themselves with the organization and the organization's goals. So lastly, why and how does the electronic health record and data sets, why are they important to students? So learning about health information management and data sets can help students learn to organize data. Students can group patient data into patterns that help students make sense of the information. The electronic assessment form supports students' critical thinking skills to bring data bits together. Students learn to use data to group data to provide information and then provide knowledge about the individual or group. Secondly, it helps them to follow outcome-based practice through automated clinical pathways within databases to study care processes and outcomes. Thirdly, to enhance clinical outcomes by decreasing errors. All of these occur by managing knowledge and information, making evidence-based decisions, and improving communication. The electronic health record use has been integrated into practicing nurses' workflows for routine tasks. Therefore, nursing students need to learn how to navigate the electronic health record, use it to access relevant information, and document appropriately. The electronic health record also needs to be present in the classroom. It can be a great learning tool for students. It can be applied actively, individually, and as a group. It can be applied actively and both individually or as in a group. Students can gain comfort in creating fictitious patients that allow them to explore varying medical issues and anticipated nursing interventions. Students can also develop case studies on which they can practice prioritizing clinical critical thinking skills. Students will be best prepared when faculty use active learning strategies when using the electronic health record. Building time on task, repetition, and depth of understanding of the electronic health record are all ways to immerse our students with this learning tool. Electronic health record use is being seen in the classroom, nursing skills lab, and even in simulation. But how will students become comfortable with these data sets and health information management? I believe students will become comfortable with these items when they are exposed to nursing informatics. Informatics combines nursing science, information science, and computer science. A number of professional organizations have provided resources to support student learning, all of which are available online. Some of these professional organizations include the National League for Nursing, the American Nursing Association, the American Association of Critical Care Nurses, the Tiger Initiative, the CUSIN Initiative, and HIMSS, which they aim to promote better understanding of healthcare information and management systems. They all have excellent resources available online to support this learning. In closing, health information management systems such as the electronic health record improve individual patient care in a health system as well as promote population health of a given area. Students need opportunities to interact with multiple technologies to gain comfort that will ultimately lead to safe and quality patient care. Both students and practicing nurses need opportunities for exposure to training on information management systems. Thank you for listening.